Good morning to the first person who's joined. We'll get started shortly. Just wanted to do a little live stream. It's Sunday morning in Australia. Thanks for the love. Hey guys, welcome. All right, already rolling in. I thought I was going to wait 5 minutes for people to kind of join, but here we go. Look at us go. Let's see if we can get double digits. Eleanor, good morning. Catherine, Derry, Diana, Tempest, PlayStation LP, Gemma, Crispy, June, WW. Good morning, everyone. Today's live stream is kindly brought to you by all of you guys. It's a 50K, I don't know, I thought it was a nice reason to do a live stream. Plus, live streams mean that I don't have to edit the video after and save some time. So it's the best of both worlds. I got a bunch of questions through Instagram. So I thought I would do a kind of Q&A type live stream thing. Hey, what's up, everyone? Wow, we already hit 20 people joining. That's cool. Man, good morning, everyone. Hope you're all doing well. I'm a little bit sore throaty, I think, and sniffly. I do have, but even rain, hail, or shine, you gotta get those videos done, right? So that's why I'm here, getting those videos done. Anna, Carla, Kay, Manuel, Cynthia. Good morning, everyone. Look, I just wanted to do a 50K live stream thing and essentially just say a really warm, genuine, deep thank you to all of you who are here now and all of you who aren't here now, who might watch this later, and all of those who are subscribed and will never watch this. So it's a massive cheers to you guys. I've just been loving this side of life, and this, YouTube is going to be a core part of my career, really. And oh my gosh, Carla, you woke up to be here. Don't do that. Maybe I should do Carla. I will do a live stream earlier so that you don't have to wake up in the middle of the night. Thanks, Catherine. Yeah, 50K. It's pretty surreal. I was doing this for like 3 years, and just getting a couple subscribers here and there, and then I got to I did a couple of Scrubs reactions, and I went from maybe 2,000 subscribers to 20,000 subscribers relatively quickly over a couple of months. But then at 20,000 subscribers, it just plateaued for like ages. And that was fine. I was getting I was gaining and losing subscribers, and it just was plateau. And then the last 3 months, the algorithm, I'll take it. The algorithm has just been nice to me. And that's fine with me. I mean, I'll accept the artificial intelligence blessing my channel. And I haven't even changed that much, but it's it's been really good. Just confirming you guys can all hear me okay. I'm still, I haven't done many of these kind of live streams through the YouTube platform. I used to do them through a different platform. So let me know if there's lag between audio and visuals, if the quality of the visuals is really crap or whatever. Okay, thank you. Thanks, Crispy. Thanks, WW. Oh, yeah, so here I am. Here you are. It's Sunday. Why don't we get through some questions? If you guys have any questions, I will prioritize the chat because you guys are here now. You guys get the priority. But I thought I would, there were some really good questions here. First one is, how old am I? Yeah, that's a fine question. I'm 29. So yeah, born 1994, born in Sydney, grew up as a kid in Sydney, then moved to Canberra in 2000, did kind of primary and secondary schooling in year 11 and 12 in Canberra, then back to Sydney for university, and did about 10 years in Sydney doing university, and then the first 2 years of working as a doctor, and then now back to Canberra for specialization training. And that's where I'm up to. And wow, Michael, you did backpacking in Sydney in the 80s. That was pretty cool. That would have been pretty cool. Interesting question, WW. Do people experience positive auditory hallucinations? Now, auditory hallucinations are considered a positive symptom, but that's not what you're asking because you mean is the content positive? It's rarely, I've never met anyone who has like a voice that's an auditory hallucination that makes positive comments. But I have met people who have voices which they like because they feel so lonely without them. Maybe because they have a really isolated life, and that their voice is what keeps them company. Um, there's definitely voices that are kind of um, ambivalent, I guess, not positive or negative. They just make commentary on what you're doing. Oh, you're picking up the teacup. Oh, he's drinking from the teacup. And yeah, so that kind of thing. Oh, right, Catherine, tell us the positive side of those experiences. That'd be really interesting. Wow, Gemma, what mental illness would I be scared of having myself? What's the worst mental illness as I see it? Excuse me. Oh, that's such an interesting question. My God, I don't like comparing suffering. Um, but the first thing that came to mind, and I haven't reflected on this deeply, but probably melancholic depression. I remember the sniffly nose. Melancholic depression is really an inability to enjoy biologically, an inability to be motivated, to see anything with salience. It's just this organic biological deficit of life. And even if you're going to die with cancer, you can still enjoy life. You can still connect. And cancer is horrible, but with depression, it removes just the ability to do that. And yeah, I'm like a pretty positive dude, so it would. I think I would be scared of that. Um, yeah. That being said, I think depression is quite satisfying to treat because it is treatable. It is episodic, and the episodes do end. And um, so when I have a patient with depression, it's quite often when you can treat it, it's quite satisfying. All right, the next question here. Maybe I'll take turns. Why did I choose mental health? That's from Noel Shields. Well, I like everything. I find everything fascinating. I would have really happily been a surgeon or a pediatrician. The closest other specialty I was going to do is emergency medicine. I really liked being able to manage chaotic and stressful situations, which is actually a very good skill to have in psychiatry when people present in distress. But I kind of looked so romantically, there's so much that's nice about medicine, about psychiatry, and I don't mean romantically as in a partnership, like in an intimate way. I mean romantically, like an artistic way. That, like, when you go into a review, it's very mindful. You have to listen. You have to be present. Your experience as a person plays into your treatment and interactions as a doctor, but your experience as a doctor and the previous interactions you've had as a doctor build you as a person as well. They contribute. So there's this yin and yang, this back and forth that's really nice. The work is it's good work. You're not stuck at a computer all day. It's a good balance from having a couple of emergencies to having interesting conversations to having a balance of administration. It is stressful, like emotionally taxing, and so it's not physically taxing like surgery would be, where doing 10 hours of procedures would really tax your body physically, but it is draining emotionally. Like when you have a day of people in crisis, at the end of the day, I'm wrecked. I can't study after that because it takes it out of me. And maybe that's up to me to find how I make barriers. I've been practicing being more calm and mindful while people are screaming at me, which is a very hard skill. But it's been interesting to try and build that skill to slow my breathing down, to slow my heart rate while someone's yelling at me. Yeah. Um, all right. Next questions in the chat. Oh, damn, the sound and audio is out of sync for WW. Can anyone else let me know if the audio is out of sync? Look, maybe it's because I'm using the actual YouTube platform to stream because it's easier. But if the audio is out of sync, then what I'll do next time, I can't do it this time, sorry guys, but I will go through a streaming platform which lets me sync up audio. Oh, okay, cool. It's inconsistent. Maybe it's an upload speed thing. All right, next question. Do I plan on returning making the Doctors Getting Coffee podcast by SH95? SH95, is that my friend Sydney Holden? No, that's funny. Shout out Sid. Anyway, I'm planning to return to doing a podcast. I don't know if it'll be. It might still be called Doctors Getting Coffee, but it might not be the same as it was. So for those of you who don't know, I had a podcast for a couple of months called Doctors Getting Coffee, where I'd interview specialists and talk to them about their life. And so what I'm going to do is I think I want to set up my lounge room with cameras and do a kind of like casual chat style where people come over, we sit down, we set up the cameras, we set up the audio, and we just do a kind of a podcast together. We chat. I wonder if I could make it live streamed. That would actually be sick. That would be so good. I'm getting some. That's cool ideas. So maybe I could do a live stream podcast thing, and that would also really save on editing time and money. That's a great idea. Thanks, guys. I will think about how I'm going to make this podcast happen, and it'd be really nice to have meaningful chats with people. And welcome, Casey, one of the OG YouTube members. Next question. Why are the hallucinations in schizophrenia mostly auditory? That's right. So in schizophrenia, if you're having hallucinations and they're not auditory, it really does warrant much more investigation into other causes for psychosis, like drugs and alcohol, and biological causes like encephalitis. So why are they mostly auditory? I do not know. I don't know if anyone has a good answer to that question. I've looked into it. I haven't found a good answer. If anyone in the chat knows why there's like a mostly auditory thing, hallucinations, let me know. My theory is that hallucinations are, with respect, obviously not in external reality. They're internally generated in the brain. And I think what's happening is the brain pathway that attributes salience and meaning to phenomena. So there's a part of your brain that attributes meaning to things, right? If you are, while you're looking at the camera, listening to me, you're not paying attention to the feeling of your shorts on your leg, because that's not what your brain is saying is important to pay attention to. You're listening to my voice. So that part of the brain that attributes salience, I think, is dysfunctional in psychosis. And what might be happening is that you're having negative thoughts that are beyond your control, and the brain is attributing a lot of salience, a lot of meaning to those thoughts in an uncontrolled way, so that they feel very real. And the way that that manifests as an experience is through sound. So the thoughts that are internally generated are so intense that they become like thoughts, like sounds, like voices, and they can sound like they're in the room behind you, around you. But that is a theory, that it's hard to prove. It could maybe be done in the future with technical imaging studies. Dennis Bolaños, can a functional neurologist diagnose ADHD? Whoa, I don't know. Yeah, I'm not sure what a functional neurologist is as opposed to a neurologist. I wonder if that's a neurologist that focuses on like conversion disorder or something. But ADHD is very common. It's not, it's not particularly hard to get a diagnosis, and a lot of people have it. But that doesn't mean a lot of people need stimulants, and that's the big issue: is that everyone's getting loaded with stimulants, for better or worse. And I don't know if it's overprescribed, or some people argue that it's underprescribed. When I'm a consultant, I'm sure I'll have more of a formed opinion, but it's not something I've done a deep dive into yet as a junior doctor. And I don't manage ADHD as an inpatient, because ADHD is really a functional thing in the community where you're trying to optimize your focus and performance. But when you're in the hospital with me, focusing on an exam isn't your biggest problem. All right, I have another question. How am I enjoying Canberra? That's a nice question. I'm enjoying Canberra a lot. I think whenever people move cities, because I moved this year, it's there are things that are very hard about moving cities. From especially your connections and relationships that you leave behind, which for me is the most important part of life, is connecting with friends and family and loved ones. But fortunately, Canberra is where I grew up, so I had lots of old friends here, and I even had some friends from Sydney who moved here before me that I could catch up with. So I haven't. I felt lonely at times, but with a little bit of effort, I was able to kind of make something happen. And it's just kind of up to me to go and connect with my friends. Whereas in Sydney, I could kind of just walk. Like all of my friends were in walking distance, and the trains to get across Sydney were so good. Whereas in Canberra, it's always driving and it's always 20 minutes, and but it's all right. I'm very happy. All right. That's right, Catherine. Hallucinations can be of any modality of sensation. So the five main ones are sight, sound, touch, taste, and smell. But it can also, this is an interesting type of hallucination. There's a type of hallucination which is pretty rare, but it's called, it's a type of hallucination of a sensation that can't exist. So it's called extracampine hallucination. And so, what's a sensation that can't exist? Well, it's sensations that don't have an obvious modality. So, for example, one that's common is the hallucination that there's someone right behind you, like you can feel their presence just over your shoulder, and you turn to check all the time, and it's horrible. It's a really distressing hallucination, and that's called extracampine, or a hallucination um, that you see someone who's in another room. That's not a real sensation. That doesn't. You can't do that when you know, when your sensorium is intact. So it's called extracampine. Ploka 1981 asks, best moment so far in my training. Oh, I had a couple of things that just came to my mind. I think I worked with a psychiatrist in one of my previous jobs who was just so good at giving me feedback specific to what I was bad at. I just found that in 2 weeks, I found I changed a lot in my manner, in my balance between being compassionate, but also being assertive and being confident. Because I think I started off the year as wanting to be friends with all the patients and wanting their approval for all the treatments. But there are times if someone is psychotic and has no insight, that you've got to make the decisions, right? And they're under involuntary care orders, so you have to support them, and it's in their favor to do the treatment against their will because they get better. So that was very. I had a very good time during those couple of weeks where I felt I got better as a doctor. What words of comfort would you give someone afraid of going to the hospital? From Ellie Fisher 96. Oh, that's sad. Oh, yeah. Let me have a sip first. I can't make a generalized statement. Sometimes it's tough. Sometimes a hospital admission can be traumatizing. And what I can say is the earlier you go, if you think you're deteriorating, the better the admission is because you catch the symptoms earlier, all the time, right? So, um, you know, we all us psychiatrists and nurses and social workers, psychologists, we all got into this work to help people. It's very rare that there's a sadistic person who, is a narcissist that wants to just no, and even if they are, they're still doing this job to help people. We're not in it to hurt people. So, I guess you just have to trust. All right, Sandra. Hi, Dr. Sill. How do you distinguish a delusion from reality when you have patterns of reality? Very hard. Oh, Sandra, it can be very tricky. And religion is a very it is the tricky side of things. Look, when like sometimes people are delusional and there's like elements of truth in it, and it's intertwined in reality. And so what do we do? Look, at the end of the day, it's not illegal to have delusions. So you're allowed to have delusions. People are allowed to experience psychotic. It is illegal to hurt people or to hurt. Well, not illegal to hurt yourself, but it is what grounds for involuntary treatment if you hurt yourself or others, even if that's from neglect. So really, I look at behaviors a lot of the time. So if I was, if someone is saying, I'm God, I'm Jesus, that's me, I am, I'm 100% sure, but that person is holding down a job, has healthy relationships, is eating well, is safe, and has never been aggressive. You can believe that. I'm not, everything seems, you're wrong. You're not Jesus. You're not God. All good. But what am I going to do? That's not a risk of harm to self or others. There might be a bit of a risk to reputation, but if you're holding on a job and there's been no issues and there's been a long-standing belief, I'm not going to do anything against your will, probably. And so that's the kind of thing. So I look at behaviors. And if your behaviors are risky, like you think you're Jesus, you can fly, you've been walking on water, and then you've been like drowning in the ocean, so like lifeguards had to save you because you thought you could walk on water or something, then it's a different story. Wow, Jeanette, good question. Can I one day talk about physical pain caused by psychological conditions? Yes, yes, I can. Because pain is in the brain, right? That's where it manifests. The source of pain can be in the body. The interpretation and experience of pain is in the brain. And so, even if you have a real cause, like an amputation, endometriosis, whatever the cause is of pain, the mental state, level of anxiety, distress, anger, whatever, that influences the severity of the pain. And as we all know, wow, it is bad when people get addicted to opioids, you know. Oh, welcome, Iminotu. I'm gonna have to practice pronouncing your name, Iminotu, maybe Iminotu. No, I haven't checked out Carol North. Maybe I should add that to my list. All right, let's add a couple. Let's go through a couple more questions. Tunja 305, heard from somewhere that you speak French. Oh, that you were French. Can you speak it? Oui, je peux parler français. Pas trop fort. J'ai un accent, j'ai des problèmes à trouver des mots des fois, mais je peux parler en français si j'ai besoin. Si quelqu'un me laisse dans le milieu de France, je pourrais organiser mes affaires pour que je peux trouver quelque quelque part pour dormir, quoi. So yeah, I do speak a bit of French. It's not great. That's my attempt at showing it off. Worm. LRM like worm is fine. Okay. Immerniture, are you telling me that I can call you worm? Bonjour, Tucker. Il faut que je continue à pratiquer mon français. I need to keep practicing my French because I'm losing it. That's embarrassing because my family is French. All right. What mental disorder holds your attention the most? You find the most interesting to study? That's from Get Sherway. Look, that changes over. Gets her way. Sorry. What do I find interesting? Changes every week. Depends what I'm kind of focusing on. And this week has been borderline personality disorder. So that I released a bit of a chat about it yesterday. I'll do I got another video on it that I might edit after this. Oh, shivers, guys! I've got to go in 5 minutes. Sorry. But yeah, if if you ask me today what's really absorbing my focus, it's borderline personality disorder, because I've been getting affected by it, and thinking about difficult chats and getting affected by the kind of emotional, because I'm a sensitive guy, when people are screaming at me and saying all these things, it gets to me. So I'm trying to manage it's called managing the borderline, managing the professional relationship with the patients, and the barriers and the boundaries and the use of silence. Yeah. I've had heaps of type 1 diabetes. Um, yeah, I didn't realize that the type 1 diabetes was a group that's much greater risk of depression. I wonder if that's because because maybe they require a lot more hospitalization as kids and have complex, maybe psychosocial stresses with parents who are stressed about managing their diabetes as kids. I'll have to look into that. But we just manage them like we manage everyone else. The question is, how much power do we give them over the insulin administration? Because if someone's acutely suicidal, you can't be giving them lots of insulin to keep on their person, and so the nurses have to administer it. Okay, Carla Mendoza. Oh, this is a good question. Marie Antoinette with a rose. Do you think dissociative identity disorder is real? I think it exists. I think there are probably some people who malinger and have conversion disorder, and don't really have true blown DID. I think it's always a result of a dissociative defense mechanism from trauma, usually sexual trauma, and and I think the goal of it is to reintegrate all the personalities into one person. Okay, so dissociative identity disorder is like multiple personality disorder, and I've seen maybe 2 or 3 patients with it in my time, so not that many. But I think if you just start getting the people, yeah, like you get the different personalities to start talking to each other, bring them together, try and realize that they're all part of one person, um, and reintegrate so that you can have a consistent experience in your ego, self, and life, because you need continuity and unity in the way that you perceive yourself. Dude, just woke up and thought it was tomorrow. It is. Well, technically, it's tomorrow. The last time you were asleep was yesterday, jellyfists. And guys, so thank you to everyone who's subscribed, and a massive thank you to the members who support the channel as well. That really makes a really big difference in, because I'm starting to use editors, and so I'm trying to use the money from YouTube to pay for editing, so I don't have to edit as much, which means I can make more videos, which I love doing. So that's the next step, is to fund my editors. I'm using a guy who's we've been working really well together, so it's been fun. But it's about 50-50. Catherine is telling Frank to not come off meds. Domperidone is what my GP prescribed. I'm thinking of coming off it altogether. I feel like it makes me worse. Do you ever come off medication? Domperidone's, yeah. I won't give any medical advice on a live stream. I think everyone understands that that's fair. So talk to your doctor, and don't stop meds without talking to your doctor, unless it's a medical emergency, in which case go to the hospital first. Thanks, Amy, for the kind comment. I'm just going through the chat. It's nice. Look at us all hanging out. Oh, you find my videos professional, Amy. That's nice. I hope this is maybe I'm being a bit unprofessional now. I find YouTube's a place I can be kind of in the middle of more personal than professional, but still talk about important mental health things in a more casual way than I would talk probably at hospital. Look, Flo, reacting to movies about mental health is probably a bit too long form. I think maybe 10 to 20 minutes is the ideal length for YouTube. Sometimes I go over, obviously. But if you have any recommendations for movies, put them in the chat. I'm sure everyone would love to see them. Yeah. Well, let's talk about medication compliance, and then we'll have to call the live stream there because a couple of people in the chat are now talking about coming off of meds and things. But like, that's it. You might be having side effects of the medicines, but just remember the side effects of not taking the medicines. Mhm. Or if you think everything's fine and stable and you don't need them, you know, ask your doctor if that's really the case, because you need a third party opinion, an outsider's opinion as to whether you should stop medicines like antipsychotics or not. Antipsychotics do have significant side effects, no doubt. The weight gain that comes with them is horrible, but it can be minimized if you get on it early and you do the right things. So you should talk to your doctors about, medicines and lifestyle interventions that can help with reducing weight gain on antipsychotics, because that's probably a common thing that a lot of people are experiencing. Um, Sandra's talking about how she's not having delusions, but she is a divorcee having a hard time. Yeah, well, that's right. There's a difference between feeling depressed because of a recent stressor, and adjusting to stressor, rather than a kind of melancholic depression that generated organically from a biological, problem in the neurons. And that the latter, the kind of organic melancholic depressions, respond better to treatment, and the former, the kind of psychosocial induced depressions, respond better to psychotherapies. But definitely, therapy and medicines, two sides of the same coin. Got to get them both. Yeah, yeah. All right, I will do one more question. And Eva has said, watched your BPD video last night. What advice would you have for someone dealing with a BPD ex-partner and father of your child? Oh, cool. Yeah, well, it's hard to do it alone, Eva. You should probably, first of all, if there's threats, that's illegal. So talk to the authorities. And otherwise, it's about healthy, safe boundaries, and ensuring that the kids are safe. And if the kids aren't safe, you need to call the relevant authorities. In Canberra, it's CYPS. And they can just do welfare checks and check-ins to make sure that everything's safe at home. But yeah, having an ex with BPD would be very difficult. Uh, and they probably are not open to you giving them advice around treatment. But what they need is DBT, CBT, and yeah, that kind of stuff. All right, well, and then thanks, guys. Yeah, no, look, thank you for all the kind things. I'm going to wrap it up now and just wish you all a beautiful Sunday with your friends and families, and stay active, go play some soccer or something, and do good things and be nice to people, and the world's a good place, and all these positive things. I do think the world's a good place. It's tricky. There's ups and downs, and humans are doing the best we can, and I think it's going to be all right. But I wish you all just a beautiful time of connection. Thank you for all the support, the 50,000 people. It's 51,000 at the moment, actually. And maybe it won't last forever and it'll dip and whatever. I'm not too attached to the numbers. I'm just glad that you guys are supporting me so that I can do something I love and that other people find it helpful. It's a win-win, and I'm all about win-win. Yeah, algorithms got my back, bruh. Kangax. All right, be well. Bisous, bisous à tout le monde. Ciao.